Hello class. Today we're going to be discussing pressure ulcers and mainly the prevention of pressure ulcers, because that's the best way to treat them. The objectives for this class will be that you'll know the 3 most common sites for pressure ulcers. You will know how to use the Braden scale assessment tool to assess your patients as needed. And you'll also learn and demonstrate how to float heels. All right, and now, you think pressure ulcers, say, oh, it's not a big deal, but it is. There are about 25 million people annually that end up with pressure ulcers. Some of them come into the hospital with one and leave with 3 or 4. So it's very important to learn how to prevent this from happening. Pressure ulcers cost the United States alone between $9.1 billion and $11.6 billion every year. And it has been said that pressure ulcers are the most costly and devastating disease of the 20th century. Now, here we have our pressure injuries status. Y'all have a copy of this. You can see that the stage 1 is just a red spot, and when you press on that spot, it will blanch. It will turn white when you release it. And if it doesn't turn white when you release it, it is a stage 1. But sometimes when you do press on them, they'll blanch, and that's good, but you know you need to start your prevention measures. Here is where it has gone beyond the redness and actually eat away some of the tissue, the pressure. That's a stage 2. Stage 3 injuries, as you can see on your paper, those get pretty ugly looking. That's gone through all the tissues, the skin tissue, and down into the subcutaneous fat layers. The full thickness injury is pressure stage 4, and you can see tendon, muscle, and bone in here. And sometimes there's tunneling and undermining in these wounds. Now, if you've got a wound that is covered with a black, like scab, that's called eschar, and it is unstageable. Or if the wound is open like this one, it has that slough, the yellow, gray, or brownish stuff inside where you can't see the bottom of the wound, that is also unstageable. Now, deep pressure injuries, these occur most often on the heels and the sacrum. Those are your 2 most common spots. See, it'll turn reddish, purplish color, and they are called deep tissue injuries because you don't know how deep that goes or how much damage is done down here. So then, with all this assessment of these wounds, when you're talking about people of color, they are very hard. They're much more difficult than just assess than someone with fair white skin. You have to usually have a halogen light that you can shine on the wound or over the patient to see where the color changes is. There's sometimes color change, and sometimes the temperature of the area will be different. It may be hotter, it may be colder. Okay. And now, into some prevention measures. You have a resident who is bedbound. To prevent wounds on the sacrum, sometimes they'll use like a Duoderm dressing or a soft silicone foam dressing on that. And they are, like I said, the assessment is your key thing. You have to assess, find out what their risk factor is, and then start your prevention measures. When they don't massage the bony prominences because it will just make it worse, you reposition these patients frequently. It depends upon how bad they are. You know, if they can move any at all, you don't have to do it quite as frequently. But if they're just laid there, they're almost comatose, then you need to turn them at least every hour. And there's also different pressure devices that you could use, like most usually on if someone is almost totally immobile, we'll use a low air loss mattress, which puts the air in and helps alleviate some of the pressure. Also, when you get a patient and they are at risk, most people especially the elderly in an acute hospital situation, they are at risk. You have to involve the other disciplines in the hospital. A nurse alone can't do everything. There's the malnutrition factors that have to be considered, so you have to get dietary, physical therapy, all the labs that you have to pull, all this stuff to make sure that you are doing everything you can to prevent these pressure ulcers. They need a high protein diet of 1.5 to about 2 grams per kilogram of weight on for their diets. You also need to push fluids, get them to drink. Every time you go in to turn them, offer them something to drink. Every time, to go to the bathroom, if they need to go to the bathroom at that time, always offer all the different interventions all at the same time, so you're not disturbing them as frequently. You also encourage them to mobilize and move as much as they can by themselves. And now I think I'm going to demonstrate for you how to float heels to prevent the deep tissue injuries which occur most often here on the heels of the patient. This is what we do is most facilities have these devices, and you would place this on the bed, put a pillow on it, and then raise your patient's legs and put them down. This is a little patient. Usually the patients are going to be a little bit bigger. But you see, his heels are floating. Theirs won't float that high above. The weight will put them down. But that is how you float heels, when you can run your hand underneath it and you don't touch the mattress or the heels. Okay? Now, I want y'all to come up here and do this, demonstrate this, how to do this. Okay, and while Tiffany is demonstrating how to float the heels, I'm going to ask Mark, what are the most common places that pressure ulcers occur?
On heels, the butt area, and on the side.
On the side, that's right. Yep, they're floating, you did good. All right, Mark. All right, and so we have covered some of the prevention methods. Like I said, we use the foam to protect them from getting ulcers. The little wedges I have there are for when you roll them, because some people do not like to stay. You could slip that under them and it's going to hold them up off of their sacrum. All right, and now, like I said, we've gone over the stages of the ulcers. One that I did forget about is the mucosal membrane injuries, and those are usually caused by medical devices like oxygen tubes or endotracheal tubes. And so that's covered. We've covered the Braden scale assessment and some of the prevention methods. So I thank you. I hope you've learned a little something. Have a good evening.